Welcome back to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And we're honored to be talking about the Mental Health Cooperative. We're with Aisha Robinzine, co-response supervisor. How are you doing?
I am doing great. I'm so happy to be here.
Well, when you talk about a statewide effort doing tremendous good around mental health and really in your end specifically working with the police department and making sure that they're equipped for success, handling difficult circumstances, there's a lot to unpack with what you all do. But let's start with a little bit of overview. When you talk about Mental Health Cooperative, give us some background.
So Mental Health Cooperative is a community mental health organization here in Nashville, Tennessee. They offer therapy, they offer case management, just a lot of mental health, honestly, like aspects, including also some substance abuse because they have like a MAT clinic as well. Just overall looking to help individuals with their mental health and get as far as into a better just space where they're able to function.
Talk about ages and that side, because working with youth, adults, so covers a wide spectrum.
Definitely covers a wide spectrum. We have adult, we have youth. We also have a crisis service that's open 24/7 to help stabilize individuals who are in mental health crisis. So yeah, they have a lot of things.
Well, let's dive into your world. When you talk about the co-response programs, go ahead and dive into your area of expertise.
Gotcha. So my area of expertise is definitely the co-response. I started off with mental health co-op doing regular crisis, and then they June 28th is when, in 2021 is when they opened the co-response. So Partners in Care is what they call it. And that is partnering a master's level clinician with a police officer, especially one who's been CIT trained. So they go through a 40-hour basically like training when it comes to mental health. The reason they did this is because like a lot of times officers are responding to mental health calls, but they're not necessarily trained to see everything and all the aspects that are needed. So it's like they were supposed to respond first and then determine, well, do we need a counselor? Whereas if we're there and we're already operating in that manner, we're able to see things and try to get people as far as into care. So when we first started, we were in 2 precincts. Actually, as of today, we just opened in Madison. So today has been a very busy day, but we've answered over 4,000 calls from the start of our program till now. And about 75% of those calls were individuals who were brand new to the mental health system. So that was a big gap that we were able to kind of see and notice. And then when it comes to that, out of those calls as well, we've only had about like a 3.8 arrest. So like our main goal is to basically help individuals, especially when they're dealing with a mental health crisis, especially acute, because that's usually what police get called out to. They're already in an acute state. Getting them, instead of arrested, getting them into actual treatment and getting basically that in place to help them, because we don't think that a jail cell is going to help.
Well, and you bring up a really important thing to kind of unpack, right? And that's what we're here to do, is unpack the challenging circumstances and to turn it into good news. And so when you look at it, to your point, police officers being called out to respond to a difficult circumstance, and the level of heightened awareness and everything going on and what's taking place, everyone is kind of in a heightened nervousness, a heightened sense of awareness, right? And so having someone who's an expert there who can identify, this is actually what's going on. Let me ask these questions, because a police officer might not know what to look for. And wait a second, this actually might be this versus this. So having someone who's a trained professional in partnership, to your point, can really figure out, okay, what's really going on? And then how do we best help? So it's not necessarily taking, the wrong approach that's going to harm both sides. So kind of unpack this a little bit. Let's start on your end when it comes to the training and the questions to ask and, going through so that they're properly prepared on that side. Walk us through that sort of training and what the individuals are equipped to be able to go out and handle these situations properly.
When going out, just depending on the call tags, especially when someone is stating that their loved one is in a crisis, it's being able to meet the person where they are, talking with them, basically stating like what's going on, what is coming on from their aspect. Also, they get nervous too. They get individuals in that crisis. They see lights, they see sirens, they see everything, and a lot of times they are intimidated by talking with officers about it. And sometimes the roles are are reversed. But even in that aspect, the officers are there just to make sure that the scene is safe. And then they are very willing and very happy to have us basically be able to talk to the person. And when we're talking with them, we're asking them, hey, what's going on? What are your symptoms that you're seeing? What have you tried? What hasn't worked for you? Listening to them and having them a part of that treatment and that role. So that we could go over all the options that are available, because a lot of times, like, we have this big sea of just like resources, but not everybody knows how to navigate it. And that's what we're there to help them do. Also explaining that process to them and making it less scary. And sometimes people are not in a state where they can understand that all that well. And that could be very hard on families. So in times where involuntary commitment is necessary, being able to talk with families and walk them through that process of what that looks like and what their loved one will be experiencing is very helpful. And a lot of families have been appreciative of that, because it's maybe the first time and they don't know what's going on. They don't know what's going to happen to their family member, what help is going to look like, what involvement they could have in it. And also just like what follow-up would look like afterwards, which is one thing that I forgot to mention. With the expansion of this program, we've seen that, we are talking with a lot of people, meeting with a lot of people, and we have also decided to like add a follow-up coordinator. So that is someone who's going to be able to reach out to the individuals that we are seeing and help them make sure that their like wraparound services are there. Are they having issues with getting into outpatient, or do they need substance abuse treatment, and walking with them and helping with them, helping individuals in that state.
Yeah. Obviously, don't name names, but give us a story that illustrates the success of this program, the power, the impact of this program.
So we're embedded precinct level. So when our counselors come in, we are in A shift and B shift at the precincts. So from 6 a.m. to 1 a.m., we have a counselor, and they're riding with an officer in the cars. We respond to not only mental health calls, but all calls, honestly, with them. And what I have seen is that in certain situations, even where we didn't think we were needed, our counselors have been able to help with individuals, just even sometimes in a car crash, and then noticing that they need services or help with other things, because it just kind of piles up. And then in instances where someone is refusing to come out and talk with anyone and threatening to harm themselves, and our counselors have been able to talk them out without use of force and get them the treatment that is needed. And also just diffuse situations like within the home. So that is our wonderful wide range of things that we've been able to help with.
When you look at the pandemic and how that opened the floodgates for the conversations around the importance of mental health, and then you see things like the heightened numbers with suicide and the issues that we're facing coming out of the pandemic, where do you kind of put, in terms of perspective, with where we are in this moment right now when it comes to mental health, what you're seeing, what your team is seeing? Where do you kind of put this in perspective?
I mean, honestly, I'm just seeing a lot of people who have a lot of things built up. Things are just kind of piling up. And honestly, just not having that access to the resources or the care. Or sometimes calling their insurances, trying to get those things, and it just being such a difficult thing to navigate, or not knowing. So to be honest, it's something that definitely I'm passionate about, with linking people to those services. And that's why I love as far as like what I do, because a lot of people don't even know about the crisis center and that it's no cost. Like, come on down, we're here to help you. We want to help you get stabilized and then also get you to like some resources. So
How can the community help your efforts? How can we help?
if you feel like you have someone as far as in crisis, you are not sure what to do, you can always call our crisis line. It's open 24/7. They are there to help you and guide you, even when it comes to, we service Davidson County, but sometimes you don't know the crisis number to your own county in Tennessee. We have all of those resources and are able to, get you to the right place. So definitely call. I mean, our number is 615-726-0125 24/7. Also, we have a crisis treatment center at 250 Cumberland Bend that is open 24/7. And also, like, sometimes if you can't get your loved ones the help that they need and they're not willing to come in, if you call as far as non-emergency, you could always ask and see as far as like if a mental health car is available. I know that by May 1st, we will be precinct wide. So we'll be in every precinct. So our goal is to just basically keep on helping individuals. And of course, just spreading the word that we're out there, we're here to help, especially like in acute situations. And that our goal is to get people treatment and diverted from the jail system.
When you look at being precinct wide, in May, what warms your heart when you look at the future of this, where things are headed? So for the vision forward, what excites you?
The vision forward that excites me is that, one, the buy-in from Metro Police Department has been amazing, from our officers on patrol on up. Them seeing the importance of this and being so eager and willing and like getting referrals ahead of time, and to them just asking questions as, when is our precinct next? Come on, we need our counselors. And then being able to hire and have such passionate individuals who are willing to take on this work. It's definitely not easy work, but willing to take up this task and basically help individuals. So like, I am super excited about that. There's always talk of expansion as far as like, once we're precinct wide, because we're data driven, it's like, where's the next need, basically. So I'm happy that that mindset is there. So that is 100% something that I am very happy about.
What have you seen in terms of the police officers working with the individuals and kind of learning from each other, in other words? So what by going out in pairs and even dealing with these circumstances that arise, with each one being unique, you have a chance to learn from each other. Like, oh, I'm learning the questions they're asking and how they're responding. How, in other words, has each other made each other better? By working together, how have you seen kind of the synergy of each other becoming better leaders, better individuals, more compassionate, more empathy? Like, what have you seen on that side?
I have definitely seen it work. It's been a beautiful thing to watch and see, because of course in the beginning everybody was a little nervous, but as far as the growth that I've seen has been like I was saying, sometimes people are more comfortable with seeing the counselor and talking with the counselor, but then there are times where that's reversed. And since our officers have been around us so long, and they're like, hey, okay, you don't have to talk to her, but what are you feeling? And like being able to ask those questions and do those things. And there's some situations where like it has been heightened so much, where like I can't necessarily get in there, but the officers are able, with that CIT training that they've gone through, able to talk that individual down and be like, hey, I have a counselor outside that's willing to talk with you, but this is the steps that we need to take. So seeing that has been the most amazing thing, because sometimes they won't talk with me, but they are so willing to talk with the officer, and the officer is asking some of the main questions that they know that I'll need, and being like, hey, and like being able to like bring the person around to talking with me. So that has been amazing, just like seeing that. And then also some officers have been on calls where it didn't come out as a mental health call. It came out as something else. And when they're there, they're like, oh, wait a minute, hold on. Can you guys swing by here? I feel like it would be helpful. So like them making referrals on calls that are not always kind of marked for mental health because of the way that it came out, but being able to spot certain things better just by being around.
Yeah. And carry that into then, I think, because what you're bringing up is it's the power of learning from each other and growing together. It's also the power of teamwork. But I think, you're seeing a very different side of the police officers, the police department that the public doesn't get to see. You know what I mean? And so I think it's a cool vantage point on your end to see how the officers care and are learning and want to do better. Like, kind of carry that into that thought process around what you're able to see then from the police officers and the police department by working with them.
Yeah, I'm able to see that 100% they are committed to seeing a change. They want to see individuals get better. They want that change to happen. They're on board with it. I have to give big props to Amy Warner. She is our CIT embedded trainer, and she has been doing a phenomenal job with the CIT program. And a lot of officers who have gone through it have been like, wow, that's really eye-opening, just all of the materials that she's been able to do and like bring it home, especially like with bringing that to the field, how it operates in the field and how they see that, which in turn has led to what we see now when it comes to working so well together. And honestly, it was good. It's good because even though we have master's level clinicians, we also do some training so that we understand their procedures and we understand as far as like certain vantage points so that we're able to work well together. And it's become such a wonderful thing to where it's just like, hey, how can we, like, even when we have tough situations, like, okay, this person definitely needs mental health help. How can we get that? So that being brought to the table a lot more.
Wrap up with, I know you mentioned the phone number, but mention again the phone number and then website where we go to carry these conversations forward.
Yes, so the crisis line for Davidson County is going to be 615-726-0125. That is 24/7. Someone will answer. If you have questions regarding your loved ones and you're wanting to know what type of help you could get them, or you're just having questions as far as like, are they in a current mental health crisis or you're concerned with them, definitely bringing your calls and questions to that number. Also, you could visit www.mac-tn.org, which is the Mental Health Cooperative's website. You will see all the available programs, treatments that they're able to provide. And last but not least is the Crisis Treatment Center, which is located at 250 Cumberland Bend. And that is also open 24/7. So you're able to come and get, if you feel like you're in crisis, they assess individuals who are suicidal, homicidal, or experiencing some type of psychosis. And we'll be able to do an assessment and see what type of resources that we could get you.
Nice. The website again is mhc-tn.org. And obviously that's the initials for Mental Health Cooperative. So Aisha, thank you for all you and your amazing team do. Thank you for coming on the show.
Thank you for having me.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.